Welcome and welcome back to my channel. So in this particular video we'll be studying a few topics of pharmacology. So pharmacology is the second year MBBS subject. In this video I'll be teaching you the antimicrobial agents. Okay, so let's get started with the antimicrobial agents. What is antimicrobial agent? What is an antimicrobial agent? So first we'll look at this. These are those drugs that acts against the microorganism. Okay, these are those drugs that acts against the microorganisms. Now, to choose a particular or an appropriate antimicrobial agent, we have certain factors. These factors are divided into three categories. We have the patient factors, secondly the drug factors, and thirdly we have the organism related factors. Now let's see them one by one. What are the patient factors? First of all, we have the first patient factor is the age. How does the age affect the selection of an appropriate antimicrobial agent? So for example, if we are giving chloramphenicol to a neonate, okay, to a premature infant, that may produce what? Gray baby syndrome. Okay, so this is how age is an important factor. Secondly, we have the history of allergy. For example, in patients with hay fever, in patients with bronchial asthma, we see what? Penicillin allergy is seen. Okay, so penicillin is contraindicated in such patients. Thirdly, we have the genetic abnormalities. Fourthly, we have pregnancy. So there are certain drugs that cross the placental barrier and that may affect the growing fetus. Okay, so these drugs are basically the teratogenic drugs. Now we have the host defenses. What does here host defenses means? That is, for example, we have patients. These are suffering from some immunocompressed diseases. Okay, we have certain patients. These are basically the immunocompromised patients. So here the normal defense mechanism is what? Very impaired. We write normal defense mechanism is impaired. So here we are supposed to give them bactericidal drugs rather than giving them bacteriostatic drugs, because these bacteriostatic drugs may not be adequate. Sixth, we have hepatic dysfunctions. Then we have the renal dysfunction. So in renal dysfunction, like we have certain drugs which are eliminated via kidney. And if there is a renal failure, so there will be accumulation of the drugs into the body and that will cause serious toxic effects. Now we have certain local factors. For example, we have activity of aminoglycoside increases at alkaline pH. So it means, like, if we have somewhere in the body we have alkaline pH and there we have to administer what? Aminoglycoside, so its activity will be increased. So this basically is depending upon the local factor. Okay, what is the local factor here? Increased pH or alkaline pH where aminoglycosides are showing enhanced activity. Now we have, okay, so let's do the other class of factors, that is the drug factors. First we have is the route of administration. How does the route of administration affects? Okay, so let's see. Basically there may be conditions, we have, depending upon the severity and the site of infections, we decide the route of administration of the drugs. For example, in some of the cases antimicrobial agents can be given orally. These are what conditions? Mild to moderate conditions. And in certain conditions, like we have severe infections, for example meningitis, endocarditis, here parenteral routes are taken. Okay, parenteral routes are preferred. Then we have the spectrum of the antimicrobial activity. This is the second factor. Spectrum of the antimicrobial activity, that is, whether the drug we are administrating is against a narrow spectrum of organism or within, or it is against the broad spectrum of wide range of organism. So we have narrow and broad spectrum. Okay, then we have the third is the bactericidal or bacteriostatic effect. These are those drugs that kill the organism. These are those drugs that lower their effects. Okay, or we can say it inhibits their growth and multiplication. Okay, now we have the fourth factor is pharmacokinetic and pharmacodynamic consideration. So here we basically see how the drug is acting inside our body and how our body is taking the drug. Then we have the cost of the antimicrobial agent. This is the last factor among the drug factors, that is the cost of the antimicrobial agent. So we basically here do what? We select cheaper antimicrobial agents. Okay, alternatives. We select what? Alternatives to expensive drugs. Alright, now we have the third or the last class of factors is the organism related factors. Okay, now we have the organism related factors. So first we have, these are the bacteriological report. So in case, depending upon the culture, depending upon the sensitivity of the organism, okay, we choose the drug. Then we have clinical diagnosis. The second factor is clinical diagnosis. So this is basically depend upon the empirical. To start the empirical therapy, clinical diagnosis is taken into consideration. Then we have resistance. Okay, so there are certain organisms that could be resistant to that particular drug, so we have to consider even that. And lastly, we have cross resistance. This is also considered while administration of drugs towards a particular organism. So these all four factors depends upon the type of organism against which we are administrating our antimicrobial agent. So this was all. Thank you so much, and please do subscribe to the channel for more such videos and content. Thank you.